My name's Julie Watson. I'm the lead cancer nurse for Hull University Teaching Hospitals NHS Trust. We understand that patients are naturally going to be concerned about visiting hospitals during this time. Where possible, we're asking people to stay at home and we're actually ringing those patients for their appointments in different ways, either by the telephone or via video conferencing.
We've tried to minimise patient exposure, tried to minimise patient travel. So I think that the video consultation, that it's a better, for the patients, they feel comfortable with it, they can see me, and I've got family members who have actually can key in as well and listen. The service is there for you. We try to make it as easy, as accessible and as reactive to you.
If you do need to come in for a face-to-face appointment, it's really important that you do this. That could be a blood test, it could be a diagnostic procedure or an outpatient appointment. We really want to reassure you that it is safe to come to our hospitals, and it's so important in making sure that you get the right treatment at the right time. As soon as you enter the building, we have a screening desk that's manned by some clinical staff and by some volunteers, and they will ask you a series of questions about your health over the last 72 hours. Some of these questions will include if you've had a temperature, and they'll ask you to sanitise your hands, and we've got multiple hand washing facilities dotted around the hospital. In addition to our screening procedures, we would ask that you would bring a face covering when you're planning a visit to the Queen Centre. Then you'll see that all our staff will be adhering to PPE measures, so you'll see people wearing masks, using gowns and gloves as they adhere to the national guidance. Here at the Queen Centre, we are delivering our cancer services, albeit in a different way. So chemotherapy, immunotherapy and radiotherapy is still happening as normal. But we are still using the national guidance regarding social distancing, hand washing. You will see all the staff wearing the full PPE and also measures that they've put in place to try and minimise their contact going in and out of the rooms. If we do ask you to come to the cancer assessment unit, we have some actually isolation bays, single-use packs with everything that they should need to make sure that your assessment goes as smoothly as it can. Some of the cleaning procedures that we have in place mean that we will deep clean an area once we've discharged a patient. So if you come to the cancer assessment unit, you know that that room that you are going into has been thoroughly cleaned before you enter it. Our usual emergency procedures are still in place, so if you feel unwell at all because of the effects of your treatment or because of your disease itself, we still have our cancer assessment unit and our triage line that are still open to speak to you. We want to reassure patients that we are still here, we are still wanting you to come for your appointments, but we do understand how difficult it is at this time. We want to reassure you at the Queen Centre we've put in lots of measures to protect you and your family whilst you're with us.